as those numbers continue to go down, the state is now working toward a plan to reopen.
And a key to reopening that plan is contact tracing. That's determining who had the coronavirus and who they came in contact with.
Channel 3 Eyewitness News reporter Matthew Campbell is joining us live now. And Matthew, how exactly is this going to be done?
Yes, Aaron and Mark, right now it's being done the old-fashioned way by reaching out to positive coronavirus patients, asking them where they've been, and then kind of mapping it out that way. But there is new technology using phones that could be more accurate, but critics say it's also more invasive.
There was a shortness of breath, there was a heavy cough, there was basically textbook coronavirus at that point.
Back in February, Joseph Kostenko thought he had the coronavirus, but because of a lack of tests, to this day, he doesn't know if he truly had it.
It was concerning, just because I kind of hoped that if I had it, I would know not to be at work, or I would know not to be around certain people.
Now that more testing is being done, we're learning of hundreds of positive cases each day. The state will rely partly on tracing those positive patients when determining when to reopen.
So that's the most effective thing we can do to reduce the spread, limit the spread, and get you back to work.
Please open the state. I am ready to go back to work, and I'm sure a lot of us are.
Critics argue it's an invasion of privacy. There's Bluetooth technology that allows your phones to track your movements. Connecticut is not adopting that type of tracing at this time.
These are new technologies which may be available in May, and I think we'll have to see how those become layered on top of our existing system.
Governor LAMONT says participation is voluntary and the information will be handled by local and state health departments. The data will be shared with New York and possibly other states and vice versa. For those who think they had the virus, they say it's a fair trade.
And at that time, I really wished that I had known, just so like I said, so I could have stayed away from certain people or, warned them about the certain people that I had been around.
The traditional contact tracing is being done on a small scale right now. Only 300 people are participating. The state thinks it can go widespread with this type of tracing by the third week of May. It's unclear when or if the Bluetooth tracing could be an option. Live above the newsroom, Matthew Campbell, Channel 3 News.
Still a lot to figure out. Matthew, thank you.